This report contains data from 5 of the NCDR quality improvement projects, including the Action Get With the Guidelines Registry for acute MI, the CAF-PCI Registry for angiography and percutaneous coronary intervention, the CARE Registry, which focuses on carotid revascularization, the ICD or Implantable Cardioverter Defibrillator Registry, and the Pinnacle Outpatient Registry. This is the first report of these national registries that provides a broad landscape of quality of care for patients with important cardiovascular conditions and undergoing important cardiovascular procedures. Again, each of these registries is deployed nationally, and many of them enrolled more than 100,000 patients in the year 2011, which is the year of data that this report focuses on. One of the main takeaways from this report is that in many respects, we're doing well in delivering high-quality care to patients with cardiovascular disease and those who are undergoing important cardiovascular conditions. But it also identifies some critical areas where we must do better in order to optimize patient outcomes. There are a number of very interesting trends that emerge from this report. In the Action Get With the Guidelines Registry, which focuses on the care of patients with acute myocardial infarction, there's good evidence that hospitals are doing an excellent job providing important processes of care to their patients, be it aspirin and other antiplatelet agents, beta blockers, statin drugs, and so on. In addition, door-to-balloon times are improving over time as well. The Action Get With the Guidelines Registry also identifies important foci for quality improvement in the future, including the overdosing or misdosing of anticoagulant and antithrombotic agents, which remains an important problem in this population, where numerous patients are receiving excessive doses of anticoagulants and antithrombotic agents when they present with myocardial infarction. The CAF-PCI registry also shows that in general, patients who are undergoing coronary intervention and stenting are generally receiving high rates of evidence-based medications, including antiplatelet agents, statins, beta blockers, and so on. Again, confirming what was found in the Action Get With the Guidelines Registry, CAF-PCI registry also shows improvements in door-to-balloon time, that is to say, the delivery of timely reperfusion for patients with ST segment elevation myocardial infarction. The CAF-PCI registry also identifies a trend towards a greater use of the radial approach in doing angiography and PCI, an important and exciting approach which, when possible, may result in a lower risk of bleeding. The ICD registry, which is used in virtually any hospital across the United States that implants implantable cardioverter defibrillators, shows an increase in the proportion of patients who meet guideline criteria for ICD implantation, show relatively high levels of medication use for patients with left ventricular systolic dysfunction or beta blockers, although with some room for improvement in these areas. And finally, a higher use of CRT-D or cardiac resynchronization devices as compared with dual chamber devices over time. The CARE registry, which focuses on carotid revascularization, shows us that when we perform carotid revascularization on patients, be it surgical or by stent, we need to do a better job in making sure these patients get follow-up and neurologic evaluation following their procedure. Finally, in the Pinnacle registry, which is an outpatient registry that focuses on the care of hypertension, coronary artery disease, congestive heart failure, and atrial fibrillation, we see in general relatively high rates of use of evidence-based medications, although there's particularly room for improvement in the use of anticoagulants in patients with atrial fibrillation. And amongst patients with hypertension, we can do better in terms of providing them with comprehensive care plans, which have been shown to be associated with better hypertension control.